Good morning. This is a very brilliant and active morning. We are going to have a political show courtesy of NFD in cooperation with the Getty Show. This morning we call it an exclusive interview since we have a mega gubernatorial bid runner that has been in the limelight for quite some months now. We are privileged to have Dr. Hassan Mohamed, who is a leading medical expert known to many and has shown his interest on politics. And here with us today, he is trying to tell us the basics about the reasons why his attention is drawn to running for governor position in Wajir County. Doctor, welcome.
Thank you, Amasant.
So to start with, who is Dr. Hassan?
Bismillah. Dr. Hassan is a person who is originally from Wajir, but whose father was an askari soldier. So he has grown up in different parts of this country. He, in the early 80s, joined university and became a medical doctor. He has been working in the health sector for about 26 years. After leaving the government service, has been in the corporate world now for approximately another 20 years. So Dr. Hassan is a person from Wajir who has grown up in all parts of this country, who has been involved in the health sector for about 30 years as a government employee, and after that has been in the health corporate sector for the rest of his life. Health sector has been my life. I've been in leadership positions in the health sector. Approximately out of all those years, it's only 4 or 5 years that I've not been in the leadership of health sector. The experience that I've had is both being involved in the educational sector of health, where I've been a senior registrar. Senior registrar means a doctor who is a consultant and is involved in the teaching process of undergraduates and postgraduate students in the health sector. I've also been involved in different sectors of the health itself, evolving government policies and programs as regards health. I've been the medical officer of health in Machakos district. I became the director of family health. Family health means health for women and children and the young adults. I've been the director of primary health care, which means the public health, the non-curative health services for the national government. I've been involved in the financing of health sector, that is national health insurance. I've been the medical officer of health for Nairobi. At one time I was the on a crisis basis sent to oversee the reorganization of Pumani Hospital, where pregnant women were having a lot of challenges, and there was significant death that raised a national cry. So I've been involved in both policy and program and emergency situations within the health sector for many years.
Thank you very much. That is a good introduction. It was yesterday when the FI community have now given you the trust to run as their sole candidate and flag bearer in the quest for governor position of Wajir County. How's your feeling, and might be you can take us through a little bit of the nomination process?
Let me start with my political journey. My political journey started in 2007. From 2007 I've been involved in the politics of Wajir. That time I was working with the national government. I felt there was need to improve on the political leadership of Wajir. So I was supporting certain leadership positions in Wajir in order to evolve a different form of leadership, political leadership, a servant leadership within our communities. I'm also involved in 2013, 2017 gubernatorial elections. These were election years, all of them. That is the main reason, was that the felt need for proper leadership, the felt need for the problems that the communities have within Wajir come to my doorstep, come to my bedroom. Health needs, social need, water need, pasture, security, all those issues involve direct interactions between me and my community. So I felt that it was necessary for me to get involved to provide that leadership that responds to these issues in a fair and just manner. For that reason, this year I have thought over it for a significant time of period. I have prayed to God, I have done istikhara, and I have submitted myself to come and try, and hopefully, inshallah, will be successful, become the governor of Wajir, to provide some level of leadership that people will see is different from previous leaderships, in terms of service delivery, in terms of fairness, in terms of policy and program direction, in terms of corporate governance. Because I see, for example, that one of the biggest problems, an immediate issue about Wajir is corporate governance, and that should not be a problem that takes time to resolve. So I then came to the community and submitted my application to the community, and the first time there was a little bit of an issue.